Joining us now is a local Alabama official who did not wait for the governor to pass a mask requirement. He instituted a local requirement of his own weeks ago in his corner of the state. I'm talking about the mayor of Montgomery, Alabama, Stephen Reed. Mayor Reed, good to see you again. Thank you for being with us. Even in your state, you instituted this mask requirement in Montgomery, I believe on June 17th. And it's valid, I believe, for a month if it's not renewed. And I don't know what's happened since then, but you did that because your city council failed to pass such a measure the night before. Absolutely.
And what we've seen since then has been our case growth rate cut in half. And so we've seen positive statistics and data coming from our residents wearing masks and our businesses partnering with us to enforce that mask ordinance. At the state level, we've seen the 7-day rolling average be about 5 times what it was at this time in June. So even though we're increasing statewide here in Montgomery, we're starting to see some better numbers because of the mask mandate that we passed by executive order. Now, our city council has come back to put that into an ordinance. And so we're happy about that. And now with the governor coming online, we're happy to have this going statewide. And we think had this been done maybe a little bit sooner, we'd be in a better position than we are right now.
Right. So you actually saw a remarkable, just to go back before June 17th, you had seen a remarkable acceleration. You did this and you are now seeing the fruits of it in a reduction in your 7-day rolling average.
Absolutely. And we had seen our hospitalizations go up every month prior to this month at a clip that we just could not sustain. And so since we decided to issue the executive order, we're at our lowest level month over month that we've been in terms of our hospitalizations from COVID-19 than we've been since sometime in April. So we've seen some positive data. We just have to keep it going and make sure that we remind our residents that we have to stay vigilant. We have to be disciplined about this, and we have to try to make this something into a group effort that's not just about me. It is about those frontline workers. It is about all the essential workers that are really helping our economy continue throughout this pandemic, and make sure that we're willing to put ourselves into somewhat, and I say somewhat, of an uncomfortable position by wearing a mask, because in the grand scheme, it's really not that major of an issue unless you have a pre-existing condition, which allows you to be excluded from the mandated mask ordinance that we have right now.
It's not that physically uncomfortable, but it is representative of businesses that want to open, people who want to get back to work, parents who are worried about their kids and what they're going to do at the end of school. So it becomes difficult to know when to press the gas pedal or take your feet off of it a little bit. And that's the problem, right? We do get complacent. We see these reductions in 7-day rolling averages in some parts of the country, including the part that I'm in, and you start to think it's okay. And guess what? Everybody starts going out. They're a little careless about their masks. They're a little careless about their distancing. And we see the numbers come back. How do you had a bit of a struggle getting this ordinance in place. How do you ensure that we don't pull it off too quickly?
I think what we have to do is to make sure that we stay in front of the public and we remind them that this is a marathon and it's not a sprint. This is something that we're going to be dealing with for months on end. We can't arbitrarily say by Labor Day or by Thanksgiving this is going to be over. We don't know when it's going to be over. So we just have to do our part. And I think if we continue to do that, not only here in Montgomery, but throughout the state and this country, then we'll see some of these strains put on our hospital system ease a little bit, because we have to be mindful, in my opinion, of our medical professionals and those people who are keeping all of us safe and healthy, whether or not we have COVID-19 or we have another issue, because we don't know when that strain workforce is really going to be tapped beyond any level that we can imagine right now. So while we have the data, we have the information from the experts, we have to do our part and take personal responsibility and make sure that we're doing things in a way that is really protective of not just our health, but the health of others.